Hi everyone, welcome. So this is a video on the introduction to anatomy. And in this part of the video, I'll be covering anatomical position and directional terms or anatomical terminologies. So first, let's see anatomical position. So simply, anatomical position is a universally used visual reference point. So in anatomy, to describe the location of organs or to describe the relationship of organs, we need to use a visual reference point, and that visual reference point is known as anatomical position. So in anatomical position, the person stands erect, facing the observer, feet flat on the floor, the arms are placed by the sides, the palms are turned forward, which means the forearm is in supination, and the thumbs point laterally. So this is anatomical position, as you see it in the diagrams, and description of location of any organ or description of any region in anatomy is assuming the body in this position. And always when we say right or left, or when we say anterior or posterior, is from the viewpoint of the cadaver or from the viewpoint of the diagram, not from the viewpoint of the viewer. It's from the viewpoint of the cadaver or from the picture. So after assuming the body in anatomical position, we need to use relative terms to describe relationship of structures. So these terms are known as directional terms or anatomical terminologies. So the first two relative terms are cranial and caudal. So cranial means superior, or it means near the upper part of the body or near the upper part of a structure. The opposite is caudal. Caudal means inferior, or it means near the lower part of our body or near the lower part of a structure. So, for example, neck is cephalic to the abdomen, or simply we can say head is cephalic to the chest or thorax. So these are relative terms. Or we can also say abdomen is caudal to chest. And the next two terms are ventral and dorsal. So ventral, it means anterior or near the front, and dorsal means posterior or near the back of our body. So for example, sternum is ventral to the spine. So the spine lies dorsally and sternum lies ventrally. So the sternum is ventral to the spine. Or we can also say the heart is dorsal to the sternum. So the heart lies behind the sternum. So we can say the heart is dorsal to the sternum. Or we can say the nose is ventral to the ear, or vice versa. The next two relative terms are medial and lateral. So medial, as you know it means near or towards the midline, and lateral means away from the midline. So for example, the heart is medial to the arm. So the heart lies near the midline. So we can say the heart is medial to the arm. Or we can say the arms are lateral to the chest. So the arms are away from the midline. So we can say the arms are lateral to the chest. Or we can also say the nose is medial to the ears. The other two relative terms are proximal and distal. So proximal and distal, they are commonly used in the limbs. And proximal means near the attachment or near the origin. So proximal, it means near the attachment or near the origin, or it means near the trunk. The opposite is distal. So distal means away from the attachment or away from the origin. So for example, elbow is proximal to the wrist. So here we have the elbow and here is the wrist. So elbow is relatively close to the origin or the attachment. So elbow is proximal to the wrist. But if we are comparing shoulder and elbow, shoulder is proximal, elbow is distal. So these are relative terms. And in the lower limb, when we see knee and hip joint, hip is proximal, knee is distal. But if we are comparing knee with ankle joint, knee becomes proximal and ankle will be distal. So these are relative terms, and proximal and distal, they are used commonly in upper limb and lower limb. And proximal means near the attachment and distal means away from the attachment. The other two terms are superficial and deep. Our body has layers, so we need to use superficial and deep terms. So superficial, as you know, it means near the surface or on the surface, and deep means away from the surface. So our body externally is covered with skin. So skin is superficial to skeletal muscles, or we can say skin is superficial to bones. And when you see the lungs are found away from the surface. So the lungs are deep to the skin, or we can also say the lungs are deep to the ribs. So our body has layers. So to describe these layers, we'll be using superficial and deep. The other two terms are ipsilateral and contralateral. So ipsilateral means on the same side, and contralateral means on opposite side. So for example, right upper limb and right lower limb, they are ipsilateral, or specifically right hand and right foot, they are ipsilateral. But the right upper limb and left lower limb, they are contralateral. So right hand and left foot, they are contralateral. And if we see some internal organs, for example, liver lies on the right side and right kidney lies on the right side. So liver and right kidney, they're ipsilateral. But left kidney lies on the left side. So liver and left kidney, they're contralateral. Spleen also lies on the left side. So liver and spleen, they are contralateral. So these are relative terms. So that's all about anatomical position and directional terms. See you in the next video.